Hello folks, in this video we are going to talk about a new concept, how pachychoroid disease may start. First, I'm going to talk to you what's pachychoroid syndrome. It's a group of diseases related to the increased thickness of the choroidal tissue. Some examples are polypoidal choroidovasculopathy, pachychoroid neovascularization, pachychoroid epitheliopathy, choroidal neovascularization, or even central serous choroidoretinopathy. There are several hypotheses how pachychoroid may develop and may play together in the same patient, so the disease may start with the final consequences in the choroid and the retina. I'm going to discuss with you one main hypothesis that has been proposed recently, which is a combination of anatomical variations of the sclera and the vortex vein. So the first principle is an increased thickness of the sclera in those patients. Second, the sclera can be also less prominent to passage of fluid or a thicker sclera. And the third mechanism would be an abnormal constitution of the vortex vein when they enter the sclera. So the increased scleral thickness and the abnormal passage of the vortex vein will block the passage of fluid and proteins from the external layers of the choroid, especially the halar layer, to the sclera, with accumulation of fluid, proteins, and colloid in the external choroid. Accumulation of fluid and protein in the halar layer and the suprachoroid will cause several secondary steps. It will increase the hydrostatic pressure on the internal layers of the choroid, like the satellar layer and especially the chorocapillaris. These layers will reduce thickness. With time, as months and years pass by, there may be ischemia in the retina pigment epithelium and chorocapillaris. This reduced blood flow or ischemia or change in the metabolic changes in the inner choroid or outer retina may be the reason of retina pigment epithelium changes, neovascularization, retina pigment epithelium detachment, among other findings. For example, as well, polyps of polypoidal vasculopathy. So we have a situation here that increased thickness of the choroid, especially in the outer layer, is the main common finding of the several diseases we talked before. In central serous choroidoretinopathy, there may be an additional change in the metabolism of the blood and the choroid of the patients, with increase in the catecholamines and the endogenous steroids, with the additional failure of the RPE and RPE changes in subretinal fluid. So when you have a patient with neovascularization, central serous choroidoretinopathy, polypoidal vasculopathy, always pay attention to the thickness of the choroid. Choroidal neovascularization or polypoidal choroidal vasculopathy may be pachychoroid driven or drusen driven. That's a very important concept as well. If the patient has many drusen and a thin whole choroid, this may be a drusen driven or degenerative neovascularization or polypoidal vasculopathy. If the patient does not have many drusen and has a thick choroid, you may think about the pachychoroid concept and pathophysiology. So I explained to you a combination of factors that may occur in order for the pachychoroid disease and the secondary disease to start. I hope you enjoyed this little summary. See you on the next video.